Good morning, everyone. I am Charis Bulay-Bulay, a fourth-year nursing student of Negros Oriental State University. Once again, I, together with my partner, Kiara Gitana Bingaan, will report to you about drowning. So now, I will continue the reporting of our topic, starting from diagnosis up to complications. So now, let's start with the diagnosis. First, we have history of submersion injury. This will include the type of water aspirated and characteristic features and auscultation of crackles in bronchi. Next, for the ABG analysis, the oxygen content is decreased, bicarbonate levels are low as well as the pH levels. Next, electrolyte levels. It may be elevated or decreased depending on the type of water aspirated. For the ECG, it shows arrhythmias and waveform changes. And lastly, leukocytosis, which indicates increased WBC or white blood cells. So after the diagnosis, let's now go to the nursing management. So first, we have to stabilize patient's neck in case he has a cervical injury. So next, we have to assess a patent airway and be prepared for administration of high-flow oxygen and assist with endotracheal intubation. We also have to assess patient's core body temperature and be prepared to institute rewarming as necessary. Next, continuous CPR, intubate patient and provide respiratory assistance such as mechanical ventilation with positive and expiratory pressure if needed. Then we have to assess ABG and pulse oximetry values. If the patient's abdomen is distended, insert a nasogastric tube, intubate the patient first if he's unconscious. Then we have to start IV lines and insert an indwelling urinary catheter. Next, give medications as ordered. Drug treatment for near-drowning victims is controversial. Such treatment may include sodium bicarbonate for acidosis, corticosteroids and osmotic diuretics for cerebral edema, antibiotics to prevent infections, and bronchodilators to ease bronchospasms. Next, we have to observe for pulmonary complications and signs of delayed drowning. We have to suction often, and pulmonary artery catheters may be useful in assessing cardiopulmonary status. Then we have to monitor vital signs, intake and output, and peripheral pulses. After that, check for skin perfusion and watch for signs of infection. Then to facilitate breathing, raise the head of the bed slightly. Then prepare to administer prophylactic antibiotics as needed. Correct acid-base imbalances. And lastly, prepare the patient for transfer to critical care unit, or if patient is a child, to a pediatric unit or facility. So now that we're done with the nursing management, let's now go to the treatment. Emergency treatment begins with CPR and administration of 100% of oxygen. Then, if hypothermia is an issue, measures must be taken to warm the patient. And lastly, ongoing support and monitoring of circulation and oxygenation should be maintained, and hemodynamic monitoring should be instituted. Let's now go to the last topic, the near-drowning complications, which is composed of primary complications and later complications. For the primary complications, we have pulmonary edema, pneumonitis, ARDS, anoxic encephalopathy, and cardiopulmonary arrest. For the later complications, we have cerebral edema, disseminated intravascular coagulation or DIC, we have acute tubular necrosis, and lastly, renal failure. So that's all for our topic, drowning. In behalf of my partner Kiara Gitana Bingaan, we thank you guys for watching our videos, and we hope that you have learned something and keep safe always, and once again, good morning.